My name is Amber Jones, and I'm presenting a report on a case of childhood Huntington's disease. This study was performed in India. So the first thing we want to look at is what Huntington's disease is. And Huntington's disease is an inherited disease that causes the progressive breakdown or degeneration of nerve cells in the brain. Huntington's disease has broad impacts on a person's life and functional abilities, and usually it results in movement changes, thinking and cognitive changes, and up to psychiatric disorders. Usually, this disease presents itself in people between the ages of 30 and 50, but it's not relegated to those age groups. It can present earlier, which cases that the disorder presents itself in people under the age of 20 is called juvenile Huntington's disease. And in cases like the one I'm looking at, children who are under the age of 10 are called childhood Huntington's cases. These symptoms that are usually presented can be managed by medication, but there is no actual cure for Huntington's disease. Unfortunately, the child in the study had very little response to medicational therapies. Now, when we want to look at juvenile and childhood Huntington's disease specifically, we realize that childhood Huntington's disease has a rapid downhill course. It was seen in the patient studied. The scientists that did the experiment realized that there are three phases to the decline of Huntington's disease in children. That first phase is an initial phase where the behavior problems start, learning difficulties begin to happen. Children can't focus, they have really hard time learning. Short-term memory is affected as well as long-term memory. And they start to have gait disturbances, and what that means is they have trouble walking, they can't walk straight lines. You notice that their gait just kind of changes. They also have a symptom called mild chorea. And chorea is just ataxia. The next phase is a florid phase that begins to show rapid mental degeneration, rigidity, which is muscle or just rigidity of the body. So certain body parts become very rigid, unusable. Muscles become very, very solid, that you can't bend arms, bend legs, things like that. Speech disturbances, they can't make out sounds, they can't recall how to say words, their sentence structure either doesn't make sense or they just can't get it out. And seizures begin to happen at this stage as well. The terminal phase usually consists of bed confinement, hypotonia, and increasing seizure activity in the brain. Now, when we look at the child in the case that was studied, the child was born completely normal and had a normal childhood development up until the age of 8 years old. At this point, he suddenly developed episodes of frequent falling, a very ataxic gait, and bradykinesia, following which one day he had a generalized tonic-clonic seizure, which is one of the more serious type of seizures. The parents and doctors noticed that these seizures are not responding to any of the traditional anticonvulsant treatments that they had. Over the next few months, the parents would notice that there was a loss of developmental milestones as well. And the child was not progressing and having current developmental milestones. They noticed that their 9-year-old at this point had a developmental age of a 1.5 to 2-year-old. The child had a regression in language milestones to where he was able to do monosyllabic speech, and it declined into just being able to mutter sounds. Despite of all the anticonvulsants the child was on, the seizures still persisted, and as stated previously, there was no history of any abnormal movements, any psychiatric manifestations, and no members of the family were affected. So it led scientists to wonder where this came from. We know Huntington's disease is manifested by a CAG repeat in a gene, and that um, longer CAG repeat leads to the production of what's called a Huntington protein, and that protein is what causes the disease. You kind of want to know a little bit more about the symptoms that happen to the children. There can be movement disorders, like I spoke about. That chorea that I mentioned, that's involuntary jerking or writhing movements, so like tics, things like that. Muscle problems, as I mentioned, the rigidity can cause contractures, which are like when you cannot bend an arm. You see it a lot in elderly people. They have arm contractures where those muscles just shorten and they can't move them anymore. They have slow or abnormal eye movements and things like that. But what we're really interested in is the cognitive impairments and disorders. As mentioned, these kids have difficulty organizing, focusing. They tend to get stuck on thoughts or behaviors, like one thing only. They lack awareness of their own behavior and abilities, so they just can't understand, like they don't have that awareness of what's going on with them. They have a slowness in processing new thoughts or finding words, so that's speech regression. They also have huge difficulties in learning information. And kind of how you see that on brain imaging is this is a picture of a normal MRI scan. And if you look really closely at this area right here, you'll notice these white spaces are pretty large. And unfortunately, in a patient with Huntington's, and this is the child that was mentioned in the study, these spots right here have atrophied and are a lot smaller than the person with a normal brain scan. And those smaller caudates and putamen really signify that brain atrophy and causes those muscle issues, the degeneration of the brain, particularly, and that loss of cognitive function. Another key thought is that there are psychiatric disorders that come from these cognitive impairments, things like social withdrawal, insomnia, fatigue. Other psychiatric disorders that happen are OCD, mania, and even bipolar depression, because they just don't understand what's going on. Just some interesting facts for you. There are, like I said, there is a cure for Huntington's. It is usually treated with antiepileptics, such as sodium valproate, topiramate for resistant seizures, baclofen for the muscle contractions as well. Another interesting fact is that the majority of juvenile and childhood juvenile juvenile Huntington's disease cases, the transmitting parent is the father because of the instability of the CAG repeat during spermatogenesis, which is the formation of sperm. And it increases if the father has a longer CAG repeat in the length. But in this particular case that we looked at, none of the family members, to include the father, were affected. Just some noteworthy experimental therapies that are going on include drugs that prevent aggregation of the Huntington protein itself, which means that protein can't aggregate and start to degenerate the brain. There's some gene therapies going on, neurotrophic and neuroprotective factors such as coenzyme Q10, and also the transplantation of fetal cells with the aim of delaying or reversing Huntington's disease. Not really sure how that happens, other than maybe those fetal cells being able to reproduce brain cells. But again, they're very experimental.